Good morning.
This is such an interesting study. Let's first of all talk about the fact that some parents these days request that their baby's umbilical cord blood be saved and stored. Why is that? Why are people doing that, first of all?
Scientists have found that if they pull the stem cells from that umbilical cord blood, you can help with a host of diseases, childhood leukemia, some cancers, immune disorders that would have had to have been treated with bone marrow. Problem, though, with parents who are considering it is, A, it's not cheap. We're talking about $1,500 to $2,000, on top of what it costs to have a baby.
Right.
Maybe $100 to $200 a year banking fees. And on top of that, when you're having a baby, you're stressed out enough to make that decision right then and there, is difficult. So they're thinking, do I do it? Is it worth the money and the time and trouble to do it?
We're talking about this morning is the first clinical trial being done here in Los Angeles by Dr. Bay, and it's called nuclear disc injection. And all that is required, it's a 30-minute minimally invasive outpatient procedure. You go home the same day, and all that's required is an incision that's only 1 centimeter big, that's pretty tiny, and a needle, and then they can pretty much go to work. What they do, Brian, is they'll take a liquid and they actually inject it into the space between the discs, the natural cushion. And the liquid goes in as a liquid, and then in just a few minutes it actually hardens into a spongy gel, if you can imagine. It feels about the consistency of a gummy bear.
Wow.
And you go home the same day, and I think that the amazing thing about it is that they'll think that if you can catch people in their 30s, 40s, and 50s with this kind of procedure, what you're going to end up seeing is far fewer arthritic problems, so you can play golf, pick up your grandkids, and do anything you want when you're 60, 70, and 80.
What I didn't realize before researching the story is that if you go to your doctor's office, all your personal information is protected by federal laws called HIPAA laws. That's if you go to your doctor, in the hands of your health insurance company. In the hands of your employer, Tony, zero protection. None. Okay? So the question is, whose eyes are looking at this information? Is the nosy woman in the third floor down the hall, does she have access to the information to find out what kind of medicine you take? And those are things that I think people need to be concerned about before they fill out all that really private information, to make sure it's secure and not in the hands of identity thieves or somebody who shouldn't be looking at that information.
What they think happens is that the caffeine increases your blood pressure and increases your heart rate, and when those two things happen, a piece of plaque from your arteries can break off, block off the blood supply, and lead to a heart attack. What they're looking at in the guidelines is men starting at the age of 45, women starting at the age of 55, having a CT scan or an ultrasound scan to see and look for that plaque on the arteries that we just talked about. Very critical, because we test for breast cancer, we test for colon cancer. This would be a heart attack prevention screening program. A CT scan's a painless test. It takes 10 minutes, and it's almost like getting a snapshot to see inside your heart. Lung cancer, I don't think people realize in this country that it's the deadliest cancer. This year, 163,000 people are going to die of lung cancer. 85% of those people, Brian, smoked. 15% of those people have never smoked. And if you take the breakdown of that 15% who have never smoked, twice as many women than men are in that category, like Dana Reeve.
Here's the key. Bosses do not want to pay for people's bad habits. And actually 5% of people are responsible for 50% of healthcare costs. So if they can figure out who those 5% are, they can really, cut their costs and save money.
I've been a medical reporter for a while, and every once in a while in a medical specialty, every maybe quarter century, something happens that changes it forever, and this is one of those changes. Based on award-winning research done by Dr. David Starver and his colleagues, when you take your child to an orthodontist now, instead of just giving your child a better-looking smile, they will give them a better-looking face. And the magic of this is not a better-looking face just for